Hello, this is Dr. Abdulghani. I am here with Mr. Ishfaq. He is interested in our exosomes. So, Mr. Ishfaq, can you tell us how you lost your hair?
Yeah, and slowly, I lost my hair start losing almost 20 years ago.
Okay.
And it was like the long journey to lose. But now the Dr. Saab is like a good friend of mine. He explained me about the exosome. And I did the 3 treatments. Today is the 4th one. So hopefully it will be as I want. But like I have like almost 30% difference between like the first day to now.
So you can see with his journey, where did you lose most of your hair? In the
almost all crown head.
Crown head. So you can see after we started it around the crown area, he's starting to get some new follicles on the top. And also in the crown area, you see the new follicles started happening. So this is the start of the hair growth. And hopefully within a year, he'll see a huge difference with the hair growth. We will show you is how the exosomes are injected. This is the stem cells that we get. It is a fetal origin, which is the 13 billion units. We will be injecting it in his area of the crown and the front area, and we will see how he responds to this. Okay. So this is the exosomes right here. So I'm starting this. Let me know if it is painful at all. What do you feel? Is it from 1 to 10? What do you feel?
It's like number 1 or 2.
1 or 2.
Yeah.
So you can see it does feel a little bit of tenderness, but it's between 1 and 2. So it is not too painful, but it is definitely, you can see as we are injecting it, it raises the scalp up a little bit. And the reason why we are doing these injections is when you do the injection in the scalp, that stimulates the hair follicles from regrowth again. You can see on the fine video, all the small follicles are starting to come at the frontal part of his hairline. And is it any discomfort at all?
No, it's fine. It's like little pinch.
Little pinch, okay. But you can see this is something very useful for people that have lost hair in the frontal area. And it is stimulating your own follicles to growing. And this is not a transplant. This is more of a growth of your own hair follicle. You can see clearly as we are doing it, it is definitely helping with your follicles from growing back and stimulating your follicles. Usually what we instruct is after the procedure not to shampoo for a day or 2 and not to put anything on the scalp for a day or 2 because you want the injection to work in stimulating the follicles. What do you feel so far?
It's all right.
Okay. We are definitely seeing that with some people do respond with just 3 treatments. Some people require a little bit more. But the key is the 13 billion units that we mentioned is the key. Like the more units is better for the hair. The 5 billion unit is good for slight response if you have mild hair loss. But for the extensive hair loss, it's better to get the 13 billion units. Okay, so we are going to inject this in this area, as you can see, and as we are injecting it, you can see that there is no reaction on in terms of like infection or inflammation or redness. It doesn't cause it because these exosomes are from fetal cells. John, can you tell us a little bit about what your experience has been with these exosomes?
Yeah, so the exosomes have been great. They're really good for regrowth over the course of about a year, like we do. I see mostly 3 treatments is usually plenty. I like to incorporate some microneedling so it can improve the delivery of the medications that they're taking. So I always like the patients to start on finasteride or minoxidil if they are afraid of finasteride, but the 3 combo works amazing for regrowth. It's always best to start early as soon as you notice your hair
As soon
loss,
as you, exactly.
instead of waiting. It's very hard to regrow hair, but it's easy to stop it.
Yeah. So I think that's a good practical point that you pointed out, that if you are losing hair, to come early on. Do not wait until you lose all the hair, and that is much more difficult to treat versus if...
But you do the transplants as well, though.
Yes, that's a good point. For people that have extensive hair loss and want quick answers, we do the transplant. The transplant, can you tell us a little bit about the transplant, John?
Yeah, so the transplant is just dependent on where you're losing your hair. So we'll go in, take an assessment of the head, assess how many grafts you would need. And then,
on average, if it's just the crown area, how many grafts do they need?
Yeah, usually about 1,500.
So for this area, about 1,500.
Yeah, 2,000.
Okay.
Depending on the, everybody will be a little different, but that area, size of the head as well, and then depending on the hair loss, will really dictate the grafts.
Yeah. So one of the things that you mentioned with the transplant is about 2,000 grafts. It's an all-day procedure. So how long does it usually take for this procedure to be done?
Usually like 6 or 8 hours.
6 to 8 hours. Yeah. So that is very...
Like 9 to 5.
Yeah. So you usually have to come for that procedure 9 o'clock and you're done by 5 o'clock. It's a very labor-intensive procedure. Usually involves about 5 to 6 people doing the transplant. But like if you are able to do the exosomes, and can you tell us, John, a little bit about exosomes? Can it be used for both male and female or just male?
So anybody can use exosomes. So they're human derived, very safe.
Is it painful?
Not painful at all. They're great just for stimulating growth. They have a lot of growth factors in them. They're more so just to stimulate hair growth. Mm-hmm. They can also strengthen the hair follicle.
Exactly.
Yeah.
So if you are losing hair, that is a very good point. We do inject it in the areas that is the hairline also. So we prevent the hair loss in that area also. So it does strengthen the... Is it painful? How are you feeling with the pain? Any pain?
No, not much.
Not much, okay. So it's very important even to inject it in the actual hairline to stimulate and strengthen and prevent loss of the current hairline. So that is a good point, John, that you pointed out. What else would you say is important when you're losing hair? Is there any other advice you can do, like in terms of vitamins?
Yeah, so just staying on with a healthy diet is always great. Vitamins, if you're lacking in any, I would just try to replace them, but it's not the end-all be-all. Good multivitamin will always help.
Biotin, what do you think?
Biotin, yeah, it's okay. It's definitely not going to regrow your hair and give you a mane, but it will definitely help improve your hair quality for sure.
So one of the things a lot of people think is if they're taking vitamins, it will help regrow the hair. That does not happen.
Yeah.
What does help is the exosomes. And this is one of the things, instead of waiting out and not doing anything, it's better to start early on before it's too late. Okay. So that is something very good that I think a lot of people can benefit from.
Yeah.
Go ahead.
And also in my thinking, if you start early, you can save like forever. You don't need to go like 3 or 4 treatment. If you're losing hair, but you can do 1 or 2. After a year or so, you can do it again.
Yeah.
So you can keep your original hair forever. But my mistake was I wait until like all my head make like big, like a kind of airport runway. And after that, I come back here.
I think that is a good point that Mr. Ishfaq, you pointed out, that if you wait too long, that is a huge thing that I'll tell people, like when you start seeing that the hair is starting to fall, do the treatment right away. Do not wait, because if you wait, then it is much more difficult and you're spending more money.
Yeah, also financially, like if you do the 3 or 4 treatments and you spend like more money, but you lose like 10% and you do like 2 treatment, and after 2-3 years you can do it again.
Yeah. So this is a good point. A lot of people don't understand. Preventative hair restoration, which is like when you start seeing that the hair is starting to fall, get the exosomes at that time. As John pointed out, it strengthens your hair follicles that you currently have. And that is the key, that you prevent it from falling in the first place. John, can you tell us a little bit about what are the factors that causes hair loss?
So hair loss is mainly from DHT. So you want to get a serum DHT. You really want to keep hold of that lab. A lot of it is genetics. So DHT is going to shrink the hair follicle, cause it to mineralize and fall out. So you want to get some type of DHT blocker to start, especially if you get a hair transplant or you're doing the exosomes. You want to keep all your hair. So the only way to do that is to lower DHT.
So I think one of the things that you pointed out, checking the testosterone, DHT levels is very important. The second thing is any kind of stress. A lot of people are putting hair treatments with like color and bleach?
Yeah, anything that's going to really damage the hair follicle.
Hair follicle. You want to prevent that. And if you are able to prevent that, that is better. And the last thing I would say, avoid using steroid if possible for the hair, because that causes scarring in the long term. So the exosome does not cause any scarring and it restores your hairline, versus a lot of people are getting for hair, like they go and they get steroid shots. I would not recommend that.
Yeah.
Okay. So that way, at least
it can really dry the scalp out and cause a lot of irritation. It
does dry the scalp out.
Yeah.
Like I think that's important, and you can see like with this treatment that we are doing right now. What do you think, Mr. Ishfaq? Is this something that you would recommend others?
Yeah, of course. Like it's much better than transplant.
Okay.
Because in transplant you can get the results sooner, but it's a lot of pain and so many people, they have like side effects, headache. I know the few people, they have like headache since 7 or 10 years when they did first time transplant.
Okay.
So
there's a lot of swelling after.
Swelling.
Yes.
Yeah.
And like I recommend, I saw like so many videos, I watched so many lectures. These, even in my thinking, if you get 50% result, this is much safer and better than transplant.
Okay. And for the people that are watching, this is what we can do. Usually for consultation, we charge around $60. For right now, we'll do consultation for you free. And if you recommend anybody for hair restoration and tag this video, we'll give you a free gift also. So please, the people that are watching, let us know if you are interested and get a chance to share this video with your friends. You will get a free gift from us and a free hair consultation. So I hope you enjoyed watching. And if anybody is interested, please call us at Mediversity Health and tag your friends and share this with your friends. Thank you very much.